In healthcare, you'll care for many patients that are not able to get out of bed. But when the patient is in bed all day, the bed tends to get dirty, quickly. Maybe they're incontinent and the sheets got soiled. Maybe they spilled their lunch. Or maybe they've just been in bed, sweating, and they deserve to sleep comfortably in a clean bed. If the patient can't get out of bed, how can you change the sheets? You can do it, and you don't need to know any magician's secrets to perform this trick. However, it does require some specific steps to pull off this impressive feat. Begin by collecting all the supplies. That's all the sheets and linen that will go on the bed. You'll need a fitted sheet, a draw sheet, a full-size sheet, a blanket, a pillow slip, and, if the patient requires it, an incontinence pad. Essentially, what you will be doing is changing the bed, one side at a time. This will require the patient to roll to each side of the bed and lay on their side while you prepare the sheets. With some patients, that may require a second person to assist with the roll and stabilize the patient while on their side. For an explanation of how to safely roll a patient in bed, refer to the video, Patient Mobility, Rolling. Once you have your supplies in the room, begin by raising the bed to waist level. Raise the side rails of the side of the bed that you will have the patient roll towards first. Then, help the patient to roll toward that side. You'll start by detaching and gathering the soiled linens. Clear the blanket and sheet so they won't be in your way. Unhook the fitted sheet from the mattress. Bunch and roll the soiled linens. If you are using an incontinence pad, roll that up first and keep it separated from the other sheets. The pad will be disposed of in the trash, where the rest of the linens will be put into the laundry bin. As you bunch and roll the linens, try to contain the soiled side of the linens inside the roll, so only the clean side will make contact with the patient. Tuck the roll of soiled linens under the patient. Now you'll begin putting the new clean sheets on the bed. Start with the fitted sheet and connect it to the two corners of the mattress. Ask the patient if it's okay if you drape the clean linens over them. If they say yes, it tends to make it a bit easier to arrange the new sheets. If they say no, that's fine too, it just takes a bit more precision to keep the sheets nicely arranged. Next is the draw sheet. The draw sheet should be placed under the middle of the patient. The top of the draw sheet should begin at or just below the patient's shoulders. The bottom should be at or just below the patient's knees. Unfold it and lay it over the fitted sheet. Drape enough of the draw sheet over the edge of the mattress to ensure you've centered it across the mattress. You'll need to have enough on either side of the patient to be able to grab hold of it when boosting a patient. If it's necessary for this patient, the incontinence pad is next. Position it centered on the mattress under the patient's bottom. Lay it over the draw sheet in this location. Now that all the sheets and pads that go under the patient are placed on the bed, you need to gather the clean sheets in a similar fashion to how you gathered the dirty sheets. But don't roll them. Bunch them together in kind of an accordion fold. This will make pulling them on the other side much easier. Tuck the gathered clean linens underneath the rolled up dirty linens. Roll the patient to the side of the bed you were just at. They will need to roll over that big lump of linens, so you may need to help them a bit more with this turn. With the patient laying on their opposite side, remove all the soiled linens first. If an incontinence pad was used, remove that separately and throw it in the trash. Then, pull all the soiled linens out from under the patient, as well as the blanket and the sheet. Take them off the bed and place them in the soiled linen bin. Please do not throw them on the floor to pick up later. Put them directly into the bin. Linen bins are located in every room at Trinity Livonia and have wheels. Bring the bin to you and use it directly. With the soiled linens out of the way, pull the clean linens under the patient. Attach the fitted sheet to the corners of the mattress and smooth out the draw sheet and the pad under the patient. Roll the patient back to the center of the bed. Take the full-size sheet and lay it over the patient. Then do the same with the blanket. You can tuck the excess under the end of the mattress if you want. You can do hospital corners if you want, but regardless of what additional steps you want to take now, your patient has nice clean sheets on their bed, and they didn't have to leave the bed to do it. But don't forget the pillow slip. You can shake the pillow in, as I did for most of my life, or a much smoother and controlled technique is to turn the pillow slip inside out. Reach your arm into the slip and grasp the end of the pillow, then smoothly pull the pillow back into the slip as you turn it right side out. Place the pillow under the patient's head and ensure that they are comfortable. Lower the bed to its lowest position. Put down any side rails that aren't needed and ensure the patient has their call light. Before leaving the room, ask the patient if they are comfortable and if they need anything.